Hey guys, welcome back. We're still on day 3 of the podiatry practice blueprint. What I'm going to show you here is I'm going to share my screen and I'm going to work you through a little bit how to use this patient presentation worksheet. Okay, so let me pull it up right here. So this here is the worksheet. What you can see here is a whole bunch of ideas of how you can do things. So to start, what you're going to do is you're going to put in the diagnosis. So for example, the one I previously showed you was on my pre-surgical discussion, but what I mostly use these on are different diagnoses. So for example, you put in plantar fasciitis right here, okay? And then I think it's, even if you do end up using mine, I think it's good for you to go through this. So what you should print this out, put in the diagnosis, you put in kind of what's working for you right now, okay? So for me, what's working is shockwave, orthotics, cortisone injections. What's not working or what's causing frustration? This is good because these are areas that you can fix on. For example, if you're not doing enough orthotics or you're wanting to incorporate bracing or other things like that, and then you write your improvement ideas. This is something that's called an experience transformer, what I learned in Strategic Coach, what's working, what's not working, and some improvements, okay? Another thing that I think is really good to include would be an analogy or an example. A lot of times we've heard that one about, using orthotics as an explanation of eyeglasses and things like that. Whatever analogy or explanation that you use, this is going to be important when you're doing your slides. You can do this in your story. You can also show a picture, like if you want to do a car that's out of alignment and put that picture in there, you can do that. Diagnostic exams, what are all the exams you do? X-ray, ultrasound, MRI, things like that. What are all the treatments? Kind of delineate all those. And then I include here in-office dispensing. Do you have an air heel? Do you have a certain brace? Do you have certain pads that you do? Durable medical equipment, do you have orthotics? Do you have a night splint? Things like that. What can I do to add value to the patient's experience? This is something that we don't always think about, but patients want to appear, they want to think that they're getting a really good value. So what else can you give them? For example, I give them a book download. I have a plantar fasciitis course. I have different handouts I send via Patient Education Genius. So all these are good things as well. And then what takeaway can the patients leave? If they want to leave with something, this might be digital. What I do through Patient Education Genius, I have a little prescription pad that I use as well. So that I give them this little pad as they leave, and then any improvement ideas. And my recommendation is when you're making your slides, I would just very easily just open up Google Slides, okay? And then put a title slide in there with a picture, explanation slide, diagnostic exams, treatment categories, advanced treatments, and then that checklist. And we'll get a little bit more deeper as we go into how to use this checklist. But this is what I would use as an example, okay? And what I'll do is I'll put my example for plantar fasciitis below here. So you can kind of get an example of how I use it. And that's just kind of an example. You can even copy those and use it for other ones, just adding in different categories. I would recommend you do your own, okay? It's a good practice to get into. If you want mine, I think there will be a course, or I have a course kind of starting out, but it's limited to only 10 people right now, but it's going to be increasing over time. Okay, once again, hope this helps, guys. And I would recommend you make your first patient presentation on your own. Okay, thanks.